Welcome to the third talk on internal disc disruption, discogenic pain syndrome. If one searches Physiopedia and then goes to the page called lumbar discogenic pain, one can read the statistic that approximately 28 to 40% of all people with back pain, the cause is discogenic. The definition can be read. If one scrolls down, one can read about examination, diagnosis, etc. One can read about medical and physical therapist management of this condition. The highlight for me on this page is the Delphi study. It, in my opinion, is spot on for describing internal disc disruption. So let's talk more about the disc and the nerve. As mentioned in the first video, when the fissure or tear reaches the outer two-thirds, mechanical and chemical inflammation of the sinovertebral nerve are initiated. This causes lower back pain. Internal disc disruption may also cause referred pain. This means you may feel pain in your glute, hamstring, groin, or anywhere in the leg. Patients often describe this as a numbness, a tingling, or a stiffness. In my opinion, an internally injured disc becomes very sensitive to pressure, twist, torque. The sinovertebral nerve gives you a warning with proper pain. So, let's look at the Delphi study from Physiopedia. Features associated with discogenic pain, directional preference. Symptoms being aggravated by lifting. Symptoms being aggravated by forward bending. Symptoms being aggravated by coughing, sneezing. Symptoms being aggravated by sit to stand. Symptoms may be aggravated by prolonged sitting longer than 60 minutes. A history of working in a job with heavy lifting and manual handling. The mechanism of injury being associated with flexion, rotation, and/or compression loading. Symptoms are much worse the next morning or day after the onset of the injury. So why would the symptoms be worse later? In my opinion, the reason for this is, as we exercise, work, we mechanically open the tear. The tear then becomes a passageway for the toxic soup to slowly and in time reach the sinovertebral nerve, causing pain. This pain might be felt at night, the next day, or even later. The next talk will be on how I evaluate and manage internal disc disruption. Thank you for listening to the third talk.